Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good evening right here from Horizon TV that is situated at Jamia Mosque, Nairobi. This is the largest mosque in the 254, capacity of at least 15,000 on a normal Friday, of course, without social distancing in COVID. Horizon TV, the premier Islamic TV station, the only station that hosted His Excellency Uhuru Muigai Kenyatta, that is a sitting president on a live TV show. I'm telling you, we're all about making histories here at Horizon TV. My name is Faisal, Kassim, and this is a live real talk. And tonight we'll be talking about matters health. Just on a lighter note, somebody once told me that there are 3 things that will finish your resources in this country. Do you want to know about those 3 things? One is a court case. A court case can finish a billionaire. From your wealth, it can take you from hero to zero. That is one. Second thing that can finish your resources is
for all those who are working with the government.
Okay.
But along the years, NHIF has gone through a lot of transformation. And as much as it might be expensive for at least the health expenses in this country is too much, but NHIF is trying so hard to come and at least closing that gap.
My brother Abdiwahab, Daud, it's one thing to have the policies on paper, but it's a totally different thing to actually see implementation at the ground. Every other day we get appeals on our social media platforms, various media platforms on different appeals for medical. Somebody is asking for X amount to be treated. Somebody is locked up in a hospital. Cannot be released until he clears or she clears some pending medical bills. So the insurance fund is there. But again, how does one go about it to an extent that he or she gets to benefit from it and we reduce all these medical bills?
The insurance is there. NHIF is a state corporation. And the main problem where you see there are a lot of expense in the healthcare sector is the private facilities. For NHIF, at least we have at least closed the gap for all government and small mission and private facilities, whereby one walks in and walks out with an NHIF card. So basically I can say, as much as NHIF is there, for you to go to, we have categories of hospitals where we have at least a legal binding contract with them. And in so doing, the government facilities are walk in and walk out, of which 98 to 99% of our clients do go there and they are very happy. And the 2% where you see maybe there are a lot of outcries is where somebody goes to a high-cost facility. And you know very well, with the amount that Kenyans are paying to the insurance as premium, we cannot cater for the high-cost facilities. These high-cost facilities have signed with NHIF a contract where we call Contract C, Contract C, of which there is co-payment or co-charging that is allowed for those facilities. And where you see this kind of outcry and problems are those who are going to seek health care and in at least high-cost private facilities, of which they are not within our mandates that we can't at least do anything about it sometimes.
What about the membership, brother? Because that's a totally different matter. We're going to talk about it in the next few minutes. But again, the membership, how does one go about it until he becomes eligible now to get some of these services? Because you've mentioned about private facilities. But again, some of these facilities that are holding people back, that people are actually having lump sum bills, are some public facilities owned by the government.
Which kind of public facilities, my brother? Because like
Kenyatta National Hospital, is it not a public facility?
Kenyatta is a public facility.
Baghdad is not a public facility?
Yep.
But again, they're still holding people back.
Or maybe that person is not having an NHIF card, or he has not introduced his membership card on entry. You know, you have to notify the facility that you are an eligible NHIF contributor.
May I ask you, please kindly, let's hold on that and then let's track a little bit back and then let's start on the registration. How does someone register and becomes eligible for to get NHIF benefits?
For one to register with NHIF, it is very simple.
Yeah.
There are 2 options. You can either visit our offices or you can do it online, either through your phone or even on our website. So if you go to our offices, we have forms.
Yeah.
You go with your ID card, copy, and documents for your spouse and your dependents, including your kids. For the kids, we need a birth certificate. For the spouse, we need the ID for the spouse, whether it is she or he, and also the contributor needs to come with a NHIF card. So, and what you call ID card.
ID card for registration.
Yeah.
Perfect. So that's what's needed.
So that's as simple as that.
After
if you
that,
can't go or access these offices, you can go to any Huduma center.
Yeah.
You will get an NHIF card.
Perfect.
Or from the comfort of your bedroom or your sitting room or even from your office, you can register with your phone. You just dial *155 hash and follow the instructions.
*155 hash, follow the instructions. You register for NHIF.
You register within less than a minute, you will get your NHIF membership number.
That will stop us from the constant medical appeals we get on WhatsApp group, and Facebook and Twitter and Instagram.
Sure.
100% guaranteed?
Yep.
For our viewers back at home, this is not a PR show, this is not a marketing show, but it is something of national importance, of community importance. We need to register ourselves. But before we get there, you're a Muslim. You're working with this insurance fund, my brother Abdiwahab Daud. What would you advise your Muslims, brothers and sisters who are outside there skeptical about this insurance scheme? What would you advise them before I get into the details of a report that was compiled by a group of experts from Islamic banking practitioners, lawyers, Sharia scholars, that they were established under the auspices of Jamia Mosque, Nairobi, to look into the operations of NHIF. So before you get into that, my brother, what would be your advice to the Muslims, brothers and sisters outside there who are skeptical on the insurance scheme?
And I have worked in different counties and districts and offices within NHIF since 2002. I was once in Mombasa. There was one time I talked to the Imam of Liwatoni Mosque, Sheikh Hassan.
No.
I was in also Jamia Mosque, Machakos, where I worked there also as an employee under NHIF. It was also a khutbah in the mosque. I worked also in Dhika, where the Jamia Mosque Imam, we talked about it at length, and he saw the urge for the Muslim community to have an NHIF card. He did that also on one of the Fridays on the khutbah. And I know I took a lot of forms to him. And my brother, also who was Imam for Masjid Salam, did a sermon on khutbah day in Masjid Salam, South Sea, about the same and how people should register. I have done several meetings with the Majlis of Ulama, the Council of at least different mosques in this country. The last one being on this week, where and we have been meeting with you several times on the same issue.
Yes.
There was one time even Sheikh Umul also talked about it at length and told the community at least to go and get their NHIF cards. So per se, this is a government initiative. It's not a private entity.
Yes.
And is a non-profit making organization, whereby maybe that is where the biggest problem comes in. So if there is profit or ABCD or something like that. So I will urge my Muslim brothers and sisters to get the NHIF card wherever they are.
So basically from your meetings with this various group of scholars, they have all endorsed the NHIF?
Yeah, we have been talking at least. The Imams, most of them have endorsed, and they even did a khutbah about it. The Majlis of Ulama, even last week, we had some deliberation on it, and we were asking. And they told me they will give their way forward to the community also. Perfect.
Two things here that are notably brought about by some of these Muslim professionals. Please, I would just want your opinion about it. I understand some of these things are still being discussed, right? They are underway, but I would just want your opinion about it. So for purposes of clearing the air. One is the investment policy of the NHIF, right? The investment policy, because some people are skeptical, saying that this money, they don't have any control over the investment of it. Would you mind to maybe shed a light on that?
Maybe the little I know at my capacity, NHIF is not an investment organization. They don't invest. It's just a pool whereby the rich, you take it from the rich to the poor, from the sick, from the at least the healthy to the poor, from the old to the young, or the young to the old. At least is a pool. It works in a social insurer fund. It's a social insurer fund. So it's a pool. And sometimes when you see our bills might be even 100%, so we have no option for investments as per se.
So basically we should ignore the grapevine that there might be investment by the insurance on entities that are not halal certified? And are you trying to say that authoritatively?
And NHIF is not a financial institution. Neither is it a profit-making organization. So basically what we focus and our mandate is social insurer, whereby most of our bills, most of our funds we collect are for hospital bills.
Entirely, no investment. One other concern that was a bit major is to basically understand the nature of benefits and compensation. What criteria is used for benefits and compensation at the NHIF?
The benefits are categorized into, we have so many benefits under NHIF. And we have the outpatient, the inpatient. The outpatient is basically, you choose a facility after being a member of NHIF for like 2 months. That is a grace period for those who are not working, what we call the self-employed. Okay. For those who are working, immediately your premiums are remitted to NHIF, you become eligible. Okay. So the benefits include surgical packages, where we have been giving surgical benefits to our eligible members. We have what we call also dialysis for those who are undergoing dialysis, whereby as much as you pay the 500 shillings per month, you're eligible to almost 76,000 per month for the same. Under the dialysis, we also give chemotherapy, radiotherapy, and also scans, which is CT scan and MRI.
Perfect. Definitely you can see there is a lot of benefit. Remember, we are streaming live on Facebook and YouTube. You can drop in your comments. Rayana Muhammad says, Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Wa alaikum salam wa rahmatullahi wa barakatuh. A number of comments and texts coming in via WhatsApp as well. You can text us on the number that's on your screen right now. Those numbers, text us on WhatsApp. You can comment on Facebook and YouTube as well. What are your questions? What are some of your experiences with the NHIF? Are you a registered member? Are you getting the benefit? If no, what questions do you have for our brother Abdiwahab Daud, who is the head of quality assurance at the
Industrial Area Branch.
Industrial Area Branch.
Yeah, quality assurance.
Yes, quality assurance officer, Industrial Area Branch. He has made time for us this evening and ready to answer all your questions right here in the studio. We are taking a break right now, getting the Adan and as well run some advertisements that have been paid for. We need to pay our bills. And then after that, we are going to be back. What questions do you have for Abdiwahab? Those are our numbers on the WhatsApp, our WhatsApp numbers on your screen, YouTube, Facebook. We are streaming live. Let's talk. See you after the break.
Uislamu ni dini yenye mpangilio ulio kamili na taratibu zake humpa fursa kila mja kuifahamu na kuelewa.
Muislamu yoyote lazima achukue jukumu la kuifahamu dini yake, kuanzia kwenye shahada ashhadu nakiri kwa moyo,
kisha usafi wa kimwili.
hapo ndipo huanza safari ya kumwabudu Mola wake.
Usikose kujiunga nasi kila siku ya Jumamosi live kwenye kipindi Ufahamu Uislamu, ili ujifunze mengi usiyojua kutoka Horizon TV.
Furaha ya nyumba ni familia, na furaha ya familia ni uwepo wa chakula kitamu. Kwa mapishi matamu ya aina mbalimbali, usikose kuungana nami Mariam Salim ndani ya idhaa ipendayo Horizon TV.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar. Ashhadu an la ilaha illa Allah, أشهد أن لا إله إلا الله، أشهد أن محمد رسول الله، أشهد أن محمد رسول الله. حي على الصلاة، حي على الصلاة، حي على الفلاح، حي على الفلاح. الله أكبر، الله أكبر، لا إله إلا الله.
Horizon TV, the beacon for the nation.
Horizon. Hello, Horizon TV. Having problems with our network there and communication. Brother Suleiman Achosa and Ibrahim Muhammad and Muhammad Samubura will be working on that. But in the meantime, Brother Abdiwahab, we are getting back into our conversation. 500 shillings per month, is it? That's what one is supposed to pay.
500 shillings per month per household.
Per household?
Per household.
Not per person?
Not per person.
Per household?
Per household.
Yeah, but that's in the new policy, in the new bill, is it?
For the bill, at least, we can't talk about it right now because
Okay.
it is in the process.
Okay.
And we're just waiting for that.
But currently, even without the bill, it's 500 shillings per household.
500 shillings per household.
For what benefits? What kind of pedigree? What level? Because, correct me if I'm wrong, I understand there are pedigrees to this. There are levels to this, correct?
And at least there was transformation of the benefit package over the year. In the year 2015, we only had inpatient care, maternal and child health. renal dialysis, rehabilitation for drugs, and substance abuses. After that, in 2016, we at least upgraded our packages to inpatient, maternal and healthcare, renal, rehabilitation.
For the same 500 shillings?
For the same 500 shillings, outpatient, oncology treatment, radiology, that is MRI and CT scan, and overseas treatment. In 2017, again, we expanded.
Wait, overseas treatment?
Overseas treatment.
When people are traveling outside for medical purposes, the same 500 can cater for them?
As long as you have gotten the relevant authorities go ahead for you to be referred for overseas treatment.
To what level? How much?
For those whom we call the self-employed packages, or the people who are paying that 500 shillings, the maximum we pay for is 500,000, 500,000.
Okay, hold on there. The caller is back on air. Horizon TV, hello. Horizon TV, hello.
Clear.
Hello, Horizon.
Hello?
Hello, Horizon TV.
Okay, Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. What's your good name and where are you calling us from?
Okay, my name is Fatuma.
Sakina?
Fatuma.
Fatuma, yes, Fatuma. Calling us from?
From here,
South Sea. Karibu sana, Fatuma. What's your question tonight?
Okay, Fatuma, not Sakina. South Sea.
Yes, Fatuma from South Sea. Karibu kwenye kipindi.
Okay, I'm just looking at the TV at Horizon, and I understand that the fund which you're supposed to pay is 500 shillings per house. Is that possible?
Kindly, would you mind repeating your question again? Hello, Fatuma?
No, what I was asking,
Yeah.
I understand that for the NHIF, you're supposed to pay 500 shillings per house. Is that possible?
Yes, that is possible. Per household, 500 shillings per month, and 6,000 shillings for the whole year. Household here includes the contributor and his spouse and the dependents, which are their children.
Okay. Fatuma, I hope that was clear. Was it? Or there's a follow-up question to that? I guess we got disconnected. The Razak Salim says all Kenyans need to register and get NHIF membership to reap the benefit of health scheme. NHIF cover limits are to ensure that every member can access quality and affordable healthcare services. Thanks so much, Fatuma. And I'm still asking you if tell us about your experience with the NHIF. Somebody is asking, but again, before you get to that, we are still explaining to us what 500 can get you. And you are at international cover, overseas cover. So it can cover up to 500,000?
500,000. Yep. And apart from that also, we cover for the surgeries and also we cover for emergency evacuations.
Emergency evacuations?
Yep.
Up to how much?
Emergency evacuations is the one for the Kenya Red Cross ambulances. So you can be at least from one point to the other. As long as you have communicated the same and you call the emergency evacuation number, give out your NHIF card, and you're good to go.
Thanks so much. I hear there's another call online. Horizon TV, hello. Hello, Horizon TV. Horizon TV, hello. Disconnected. Thank you so much for the notification. He disconnected. Kindly, when you're calling, tafadhali punguza sauti ya runinga yako ili tuweze kuwasiliana hapa. Tupigie simu, wasiliana nasi. Je, experience yako na bima la kitaifa au the NHIF imekuwaje? Uko na kadi, umeweza kuenda kutafuta matibabu ukatumia kadi yako. Je, ulipata jibu gani ama ulipata huduma? Abdiwahab Daud yuko hapa ndani ya studio kuweza kutueleza zaidi. Abdiwahab Daud, so that's one package, 500 shillings per household per month. That is person who is eligible. That is a person who is able. For those who are not able, what happens? I'm not able, I'm not working, I'm not employed.
At least for those who are able, we have those which we call sponsored, under the sponsored programs. For those who are under the sponsored
Would you want to hold it there because you have another call coming in? Horizon TV, hello?
Yes.
Horizon TV, hello?
Yes, I can hear you, brother.
Yes, brother. Karibu sana kwenye kipindi. What's your good name and where are you calling us from, my brother?
My name is Abdiwahab Salim.
Abdirazak Salim, karibu sana, my brother.
Asante sana. I just want to talk about my experience with NHIF.
Yes, please.
There was an incident whereby a lady that was from Mandera, she had a problem with bilateral kidney failure. And she was from a less fortunate family. So the lady, as we were struggling to get the financial that she needed, she was using her NHIF cover. You know, at least NHIF was now filling that gap as we were struggling to collect financial to get her assistance.
No.
So initially, the lady was NHIF. What they were providing was like the bed covers, all blood tests, the what do you call whenever she needs X-ray or whatever scans, they were all giving out. I think NHIF is the thing to go at this moment, and that 500 shillings and whatever you're getting as an output from the government is not the same, because 500 shillings is in a month is very, very, very tiny money.
Yeah.
But in return, what you get from the government is a hell of huge services. You just walk, if you are registered with NHIF with the card, you just present to the facility, preferably it should be public, so that you can get the best service that the government provides. So with me, NHIF is the thing to go at this moment whereby people are struggling with financial huge problems.
No.
So in order to overcome this, NHIF has to do a lot of sensitization and mobilization and mass registration.
Yes, thank you so much.
I know the president has flagged UHC some time back. It was pilot project in some counties. That was maybe, I think, Cielo, Nairobi, and maybe 2 other counties. But it has to be the whole 47 counties so that at least the government can put back resources to the county referral hospitals so that these people who are registered with the NHIF cover can benefit more, because sometimes you might see a place like Mandera, where I come from, you might not get the best services in the public hospitals. That's why you see people prefer going to the more of the private hospitals.
Wonderful. Brother Razak, where are you calling us from?
But if we get in the public hospitals, if we get good services, then people will go for the public hospitals. Why refuse? We can get good service. So once the government provides enough resources to these referral hospitals, I think NHIF will be the best thing that the government has ever done. Thank you so much.
Great. Before you go, Brother Razak.
Yes.
Where are you calling us from, please, if you don't mind?
I'm calling from Nairobi.
Nairobi, which area specific, please, if you don't mind?
Pangani.
Pangani, thank you so much, my brother, for your contribution. Jazakallah khair.
Thank you so much.
Thank you. Now, Brother Abdiwahab, you're telling us about air evacuation. So these are some of the benefits that someone gets with the NHIF cover for just 500 shillings a month. And I asked you a question. So what if someone is not able to pay that 500 shillings a month? Someone is not able to do that. What happens then to that person?
And for those who cannot, there are a lot of sponsors outside there. One, the government has already sponsored 3 categories.
Okay.
One is the Edu Afia. Edu Afia is for those public secondary school going children.
Okay.
Are fully covered by the government of the day. Public secondary school going children.
No way.
Yep.
No.
Yes. You can take that to the bank.
What?
Yep.
You're going to Any student outside there who's going to a public school in secondary
student
is covered.
outside there.
Okay.
Gone are the days when parents were asked for medical allowances or medical fees for their kids.
Wow. Great. That's great news.
There is the other package we call the Inua Jamii.
Okay.
Under the government. Inua Jamii are those at least who are also the old citizens of this country. Those who are getting some stipends from the government are all eligible and registered.
Okay.
The third one is the Linda Mama initiative by the government of the day too.
Okay.
There is no mother in this Republic of Kenya today who I call maybe those who are not, who cannot at least pay for their 500 shillings are entitled to Linda Mama. You don't need to have an NHIF card to benefit from Linda Mama.
Where is all this information?
This information is always there.
Where?
It has always been there, my brother. Linda Mama.
One thing, Abdiwahab, and then you're going to agree with me, every time we meet and talk about this, we always discover new things about NHIF. And we always...
Even in Linda Mama, you don't need to have an ID card. You can be a minor who got pregnant and you want to get the services for maternity from any government institution. And those private facilities which have been at least accredited by NHIF to undertake that kind of services, you only need even your antenatal card to register for the Linda Mama.
Oh my God. Let me just make a public appeal right now, Abdiwahab, to patieni kazi tuwafanyie marketing, because you have a lot of information, a lot of goodie bags that viewers don't know. I don't know myself, and I'm in the information industry. I don't know myself.
The problem is they say everything that is written is hidden. You can get it from our website.
Again, we have
you can get it from our brochures. You can get it from our offices. We have offices everywhere in this Republic of Kenya, each and every county.
Abdiwahab, I'm bringing a proposal. We need tunataka hiyo kazi. Tunataka kazi, we help disseminate this information.
No problem, we'll talk.
Just reply with, raise your hand in the comment section if you agree with me on that. To disseminate this information.
Do you know that each and every Kenyan who has an NHIF card is eligible for ambulance evacuation from everywhere? You just call 1199. Kenya Red Cross ambulances have been contracted by NHIF to offer evacuation services for its members.
Free. I'm not paying.
Free.
Because
without
I'm paying
500
NHIF already.
Yep.
Okay, so guys are still not yet commenting. Abdurazak Salim, Ibrahim Muhammad, NHIF, the way to go. Ibrahim Abdullahi Rayed. Come on, guys, just reply with your hands up if munataka tupata hiyo kazi, so that tubaki hapa tufanye kazi. One thing, there are others who are employed. Yep. There are others who are employed, and NHIF contribution is deducted as per their salaries.
As per their salary.
Some of them are deducted up to 1,300.
Yep.
Some of them up to 5,000. According to their salaries, is it?
Not 5,000.
3,000, sorry.
1,500, 1,700 is the highest.
1,700?
Yep.
Yes. So for those people, then what are the benefits for someone who's paying that amount?
The benefit, I told you from the start, NHIF is a social insurer. You take it from the rich,
give it to the poor.
Share it with the poor.
Perfect. That's understood.
The more money you get, you cater for those who are getting less. There are those who are employed who are also paying 150 shillings.
So I'm getting the same pack?
Because they have the minimum, who are being given the minimum wage.
Okay.
So as long as 150 shillings. There are those who are getting 100,000 and above are the ones who are paying for 1,700.
So the person who is paying 100 and the person who is paying 1,700, they are all getting the same packs. So if you want something extra, you have to go to the private insurance. That's what you're saying?
Yeah, those who want to get extra, but there are those who the government employees are given what we call comprehensive medical insurance by the government. Apart from the 1,700 or the 1,000 or the 500 they are paying, the government tops up on their behalf so that they can get a comprehensive cover. Instead of taking them to a private insurer, now they are plumping in the money to NHIF.
So there's also an option for a comprehensive within NHIF that corporates can get.
Corporates, parastatals, Kenya Retired Association of Kenya Association of Retired Officers. There's also another one that we call Kenya Association of Retired Police Officers who are also coming on board. So if you have also been retired at one point, you can also get a comprehensive care.
Wow, 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 wow. I'm told I have to wrap up and chuck, but so tell us about facilities, particularly private facilities with the NHIF. Can I access private facilities? If yes, then to what level or what's my limit?
And the private facilities, most of them are in a contract that we call it contract C. They are allowed to co-charge. We give them a rebate, a bed rebate. A bed rebate means per night you are eligible to 1,700 to 4,500.
Per night?
Per night, depending on the facility you will visit.
That is inpatient?
Inpatient.
Outpatient?
For the outpatient, there are those who have at least consented to our contractual basis that they have signed the contract with us whereby our customers can go and visit them on the outpatient. And mostly the big facilities or the high-cost facilities have not signed those contracts yet.
Okay. But it's
so you cannot access, the only thing you can access is the CT scan, the MRI, and maybe the dialysis. And dialysis is fully paid.
Goodness. Goodness, goodness, goodness. A lot of goodie bags that are within NHIF that we are yet to explore. Brother Abdiwahab, definitely I need to have you again, inshallah. Would you accept my invitation?
Anytime, my brother.
This time while we are doing this show with my brother Abdiwahab inside the studio, I want you to be part of that. How do you take part in that? I want you to please record a video, maximum 90 seconds of yourself. Tell us about why you have NHIF or why you don't want NHIF. Record the video, send it to that WhatsApp number that's scrolling on your screen. Send in that video. Yes, my brother Abdiwahab, before I wrap up the show.
At least I will appeal to all Kenyans who are also watching today that getting an NHIF card is easier than even sipping the cup of tea next to you. From the comfort of your mobile phones, because every Kenyan today has a mobile phone, you just dial 155 hash and register and pay through M-Pesa. You don't have to go to our offices, you don't have to go to the bank, you don't have to queue everywhere. You just go to M-Pesa, pay bill number 200-222, account number is your ID number because that is the unique identifier in NHIF. And pay either 500, 1,500, 2,000, 6,000 for the whole year, whichever capacity you have at that moment.
Great, 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 great stuff. Abdiwahab, itabidi ununue chai because you've marketed NHIF here. I'll talk to your boss, man, and ununue chai. You know, you didn't pay for the advertisement.